Baby Chakra and to have this interaction with all of your audience and guests. I'm Dr. Tushar Parikh. I'm a chief neonatologist and pediatrician at Motherhood Hospital at Kharadi and Lulanagar in Pune. And I look after newborn babies in the newborn ICU. Plus, I see babies and children up to age of 15 years. And vaccination is I do every day. And so, thank you for this interesting topic also.
Great. So let's dive into the topic. Let's start with a discussion of how important the vaccination is and the current problem that we're facing with the vaccinations.
Yeah, Simaji. See, I'm sure now vaccine, this terminology now everybody by default it knows because of this COVID pandemic and how important it is. We've been able to get rid of this COVID pandemic. I should not say get rid, but to a stage where we are seeing some amount of control in COVID pandemic. It's because of vaccination. We have to realize this. Even today, what patients of COVID infected patients that we see a very mild disease, and even those patients who are coming to ICU, 90% of them they are because they have not received their vaccination. So at the outset only, I'll a sincere request to all the viewers who are eligible to receive COVID vaccine, they must receive the vaccine. See, the vaccination in humans, the major breakthrough was by Edward Jenner in 1796, more than 200 years ago, and where he showed that inoculating cowpox vaccine, cowpox virus into humans protects against smallpox. And then at that time, smallpox was a very common disease, and it was rampant, and people used to get a lot of people used to die, and people who used to survive, they used to get disfigured lesions on the face and the body. Today we don't talk about it, thankfully, because we've been able to get rid of smallpox, complete eradication of smallpox about 40 years ago, and it is all because of vaccination. So vaccination has played a major role in controlling not only smallpox is out of picture. We don't know, we've not seen smallpox, but there are many diseases which have come under control. So 20-30 years ago, there used to be wards in the hospital full of tuberculosis patients, a ward dedicated to diarrhea patients, so on and so forth. Now it is not seen, and the reason it is not seen is because, yes, improved hygiene, improved sanitation, plus vaccination has played a major role, that these patients are not coming up, and even if they are getting the disease severity is much reduced. So vaccination is that way important. So what we do, so currently the vaccination which is rolled out in the country, that is universal immunization program, that was started in India in 1985. So it's more than about 40 years old vaccination program. Until recently, there were only basic vaccinations were being given by government, but now I think a reasonably good number of vaccinations are being provided. It differs in different parts of the country, but yes, I mean the coverage is now expanding. And there is a schedule which is recommended by World Health Organization, and depending upon geographic prevalence of various diseases, various countries, depending based upon the WHO recommendation, the various bodies in the different geographical regions, they come out with their own recommendation for their population. So, for example, in India, we have Indian Academy of Pediatrics, which is a body of pediatricians from all over India, about 30,000 pediatricians, and then there is a committee of vaccination, and this committee of vaccination takes kind of into account evidence, new research which has come into light, and that particular evidence is taken into consideration, and a vaccination recommendation schedule is given to pediatricians who are practicing in this country. So largely pediatricians who are there in this country will follow a recommended schedule by Indian Academy of Pediatrics, and that particular schedule is slightly different than that what is given by government. The number of vaccinations which are recommended by Indian Academy of Pediatrics is slightly more than what is there in the government schedule, understandably, because government has got different priorities, and the funding and the resources are little limited with the government section, but therefore in a large mass scale out, it is little difficult for government, but I think they are catching up. So this is how the immunization schedule we follow. Now, what we do, a newborn baby, a baby once the baby is just born, in the first few days, we give baby BCG vaccine, oral polio vaccine, and hepatitis B first shot we give, and after that, at 6 weeks, 10 weeks, and 14 weeks, there are three vaccine visits, and at each visit we cover them for eight different diseases: typhoid, diphtheria, pertussis, polio, and then hepatitis B. We also cover them with rotaviral disease, and we also cover them with pneumococcal disease. So there are eight diseases which are covered at 6 weeks, 10 weeks, and 14 weeks. Then there is a vaccine at 6 weeks. We give them flu vaccine, that is influenza, and 7 week is the second dose of influenza. And then 9 months there are vaccines like MMR, and then typhoid vaccine is also given around that time. And then at 1 year there is hepatitis vaccine, hepatitis A vaccine, and Japanese encephalitis. And then the second year also, up to age of 18 months, there are few more vaccines like chickenpox vaccine, then booster of DPT, so on and so forth. Now, I think we have limited time in the sense that I would like actually to tell you about each and every vaccine in detail. But I think what you would like me to do, Simaji?
Or like,
Uh,
can you give a gist of vaccination and what diseases they prevent? You can give a gist of it so that the users might know why are they actually taking those vaccines.
Correct. So, coming to the newborn baby, BCG vaccination we give in a newborn baby, we give it on the left shoulder. So, world over, wherever it is given, it is not given in all countries. It is given in the left shoulder. So, the vaccine when we give, it will give a small white bleb which disappears after a few hours, but then it will form a small kind of a abscess like thing after a small pustule, not abscess actually, a pustule after 1 month, and after kind of 3 months there will be a scar, and that scar remains for the rest of your life, and that is kind of an indicator that the child has received vaccine of BCG. BCG vaccine is against tuberculosis. It does not help completely prevent tuberculosis, but it helps in preventing serious forms of tuberculosis. And therefore, India has decided to still continue with BCG vaccination, even though many countries are not giving BCG vaccination as of now.
Okay.
Then coming to the oral polio vaccine. Now, oral polio, do boon zindagi ke, we all know that. And oral polio vaccination we give at newborn period in the birth time, and then we previously we used to give vaccination of oral polio at 6 week, 10 week, and 14 weeks, but now it has been replaced by injectable polio. And so a lot of parents ask me why oral polio changed with injectable, why we are not giving oral polio drops. But again, that oral polio helps you to protect against polio. In 1950s and 60s, there were wards full of polio patients, and people used to get paralytic polio, and it's a very disabling disease. Thankfully, because of universal immunization, we are able to control polio, and polio is on the verge that we will be able to kind of completely get rid of polio from this world. So this is something, a dream, and that we are all are pursuing. Now,
Okay.
coming to the third disease where we cover is hepatitis B. Hepatitis B, there are three injections, a minimum three injections within the first year one should take, and that helps to protect against hepatitis B, which is a blood-borne liver disease. And the protection against that, because we are in an intermediate endemicity zone. In India, is about 4% prevalence is there hepatitis B, which is a significant prevalence, and therefore we must all get protected against hepatitis B. We are not seeing so many patients of tetanus nowadays, and the reason is because we are covering everybody with TT or DPT or triple vaccine, that is tetanus vaccine. And that again, as per the schedule, there are at least four doses that one has to take at 6 week, 10 week, 14 week, and again a booster at 18 months.
Okay.
Pertussis is a whooping cough. Again, pertussis is something which we are able to protect, and unfortunately, as the individual grows after 50s, 60s, there is some waning off of protection against pertussis, and therefore nowadays we are kind of recommending, if a preterm baby is there in the house, we again check for pertussis, and sometimes we have to give pertussis vaccination to elderly also if there is a waning. Also, we are now protecting children against diphtheria. Diphtheria is again not seen nowadays. Against it's a throat infection and it spreads, and it is a toxin which spreads and paralyzes the body. So that is what we are not seeing again. Then the next one is a pneumococcal vaccine, that is a pneumonia vaccine. So pneumococcus germ is very peculiar. It is basically causes pneumonia, but then it is the same germ which causes ear infection, same germ causes brain infection, and so therefore pneumococcal vaccine is something which is very important, and it helps protect individuals from pneumonia and other spread diseases. Then there is something called as Haemophilus influenzae B, HIB. Now,
Yeah.
HIB is a component which is there in the 6 week, 10 week, 14 week vaccination, and this HIB is basically one which causes brain fever, and that is something which we don't see now. And thankfully, because in my career, 15 year, 20 year ago, we used to see rampant Haemophilus B meningitis, but now we are not seeing because we are able to do vaccination. Recently, last patient I saw is about 3 years back, and one of our watchman's daughter they brought from Nepal, where they had missed the vaccination, and that girl had hip meningitis. But thankfully now it is not so common. So that also something which we cover, and then something we also cover is rotavirus vaccine. Now that is also given orally. Rotavirus is given orally at 6 week, 10 week, and 14 weeks. Rotavirus is a disease which causes loose motions or acute watery diarrhea, and in Indian context, even so in Pune context, we had done a study about 10 years ago, and there we showed that about 30% of watery diarrheas in children less than 5 years are caused by rotavirus. So once you give this rotavirus vaccine, out of those, a significant number of those diarrheas you are able to prevent.
Okay. So
One
Dr.
more important,
Yeah.
yeah, yeah.
No, tell me.
One more important thing, what we are also recommending is giving vaccination to mothers.
Okay.
So, like say for example, if mother takes tetanus vaccine during pregnancy, that helps baby to protect against tetanus, neonatal tetanus. Also, we are recommending mothers to take flu vaccine during pregnancy. So that helps baby to protect against flu in the first 6 months. And also, we are recommending now COVID vaccine also for the mothers. That also helps to protect the baby against COVID. Yeah. Yes, Imagine.
So I wanted to know what are the common side effects जो आप experience करते हो newborns में जब आप injections देते हो या oral vaccination देते हो, कुछ common side effects होते होंगे जैसे fever होता है, तो काफी सारे users जो हमारे हैं newborn के जो mothers है अभी recently जो mothers हुए हैं, they have a question कि fever आता है तो हम medicine दे क्या? Is that recommended?
Yeah, so common side effects, as you rightly said, fever is a common side effect. More at the time of giving vaccination, there will be little pain. And as a parent, I know it is very difficult to bear that pain. Baby keeps on crying, and parents also get very badly disturbed. But believe me, that is something which you are doing for the good of the child. So always remember the larger picture. We as a doctors, we do it every day. Sometimes we feel, but we can make out, because that is something which is a very traumatizing for the parents, and sometimes parents avoid giving vaccination because of that. But please believe, remember that these vaccines, little pain at the time of giving vaccination will no pain, no gain without pain. That is what is said. No, so little pain is okay because that will help to protect child for the rest of his or her life, and that is beneficial. So don't worry about that little pain. But yes, a common side effect, if you ask me, there may be little pain at the injection site in the 1 or 2 days, and there may be little fever for the child, and that is generally not very high. And if required, we can give paracetamol, and that fever comes under control. Some vaccination has got a higher tendency for fever. In that case, we proactively give paracetamol for 2 days, and that will help prevent fever. Other than that, serious side effects are extremely rare, extremely rare, not worth mentioning also. But yes, I mean, some children may have poor feeding for few days, excessive crying for a couple of days, 2 3 days, swelling at the extremities. Some of the vaccines, they have a tendency to cause swelling at the injection site. But again, if the swelling or nodule formation, if it is there, that will disappear over a period of 10 days or 2 weeks. And if swelling is there, that will go early, but nodule will take maybe up to 3 weeks to go. So those are mild side effects, and don't worry about those side effects because they can be easily managed.
So for the swelling and pain, is that ice pack is recommended or some recommended cream that you give to reduce the redness, the pain on the injection side?
Yeah, absolutely, Simaji. Yeah. So we recommend paracetamol as a medicine, but when there is a swelling, we recommend applying cold pack, applying ice. Don't apply any warm packs or any hot packs on that, because that will further aggravate swelling, aggravate pain. So this is an important message. In case after vaccination, if there is any swelling, if there is any pain, apply ice. Put it in a plastic bag or cloth and apply it there. Apply it for 3 to 5 minutes as per the tolerance of the child, and apply it 2 3 times a day for a couple of days.
Okay. So we all know how important it is to maintain a vaccination calendar कि time to time बच्चों को vaccination मिले. But if in any instance अगर कोई booster dose या कोई second dose या third dose vaccination का miss होता है, so as a doctor, how do you tackle those situations? What is the
Yes.
advice?
Yes, so you should visit the pediatrician, and almost all vaccines we can reschedule and give it. There are certain exceptions. There are certain age brackets beyond which a particular vaccine is not allowed, or a particular gap between the two doses has to be maintained. So every vaccine has got their particular kind of nonsense and recommendations. So your pediatrician will be able to tell you. But in almost all instances, whatever vaccine is left out, they can be covered, and the schedule needs to be modified a little bit, and that your pediatrician will be able to do it.
Okay. So I have a very important question which will be a major topic. So COVID vaccination अभी kids के लिए ready हुआ है and
Yes.
people are taking it. So what is your advice? What is your take on it? How safe it is?
Yes. Now, fortunately, COVID vaccine is recommended for children 15 to 18 years. We are waiting for younger children also. But yes, it is a very important vaccine, as we all know, because we have been able to bring COVID under control, little bit control, because of the vaccination. And as I said, already said, whatever serious COVID infections we are seeing today, whoever is admitted in the ICU, I visit ICUs also, and generally I'll peek into adult ICU also, and whoever is admitted in the adult ICU, almost all of them, they are in the ICU because they have not received vaccination for certain some reason or the other reason. And almost 90% of them, they have not received their vaccination, and when they get a COVID, they get a bad COVID. That is unfortunately the problem. So even in the age group of 15 to 18 years, we've seen children with comorbidities, children who are obese, they sometimes can get a bad COVID infection, and also it helps them to kind of prevent the spread of the disease also. So it is a strongly recommended that all children above 15 years, they must take COVID vaccine.
Okay. So one of our users has asked a myth question कि COVID vaccination लेने के बाद they say that you are more prone to having an infection immediately. So you have to take more precautions. Is this true or if it's a myth?
No, it's a myth, because what happens, COVID vaccination, as per se, whatever vaccination which is recommended in children is a killed vaccine.
Right.
So there is no actually live vaccine in that vial. And in certain live vaccines, there is a tendency for little drop in immunity for next 2 or 3 or 4 weeks.
Okay.
But that is not applicable with COVID, because COVID vaccine, that is which is given to children or for anybody, is a killed vaccine. So there is no drop in immunity, and there is no increase in susceptibility. There are certain vaccines like MMR. There are certain vaccines where there may be little drop in immunity, which may make them little prone for infections, other infections, any infection for that matter. But it is nothing to do with like COVID. So all COVID vaccines are safe, and they do not cause any drop in immunity. And wherever age appropriate, they should be used. Yeah.
Okay. So for premature babies, is there any extra vaccine that you give or you follow the same calendar जो normal बच्चों के लिए आप use करते हो?
Yes, premature babies के लिए same calendar, but we have to modify, because generally minimum weight of the child to start vaccination is about 2 kgs. So we manage babies right from 500 grams, 600 grams. So they take long time to recover from their own kind of illnesses and achieve a good weight. So generally most of these vaccinations are done during follow, and their weight has to be at least 2 kgs to start vaccination. Uh, because we are starting the vaccination little late from their birth age, we have to modify the vaccination schedule little bit. But all vaccines we try and give all the vaccines which are there in the schedule, Indian Academy of Pediatric recommendation schedule, because these babies, they tend to have little lower immunity in the first 1.5 year, 2 years. Their immunity is not at par with other children. So more the reason that they should receive all the recommended vaccines.
Okay. So I have one last question from Swati that after taking the vaccination, क्या चीजें उनको avoid करनी चाहिए उनके बच्चों के साथ? Is there something specific that they should not do?
So generally, there is no specific recommendation like that. Generally, we used to say initially that after oral polio, don't feed immediately for 15 minutes.
Hmm.
Now they say anyway the food gets mixed with vaccine, there is no problem like that. Or so a particular food item avoid, not avoid, give, not give, nothing like that actually. So generally, there's a simple recommendation is that after vaccination, you should wait for 15-20 minutes, observe the child. The child is otherwise healthy, not showing any reaction in the form of say rashes, or sometimes they may get fainting, bigger children sometimes, and there is no reaction, there is no rashes anywhere, and after 15-20 minutes it is safe to kind of leave the place, and generally there is no food wise there is no separate recommendation.
Okay. It was a very informative session, Dr. Tushar. We have finished all the questions. Where your information was, good enough to, actually cover all the questions that our users had actually. So, is there anything more you want to add for our users to follow your recommendation?
Yeah, so see, there are myths around vaccinations. Are many myths are there. There are lobbies which are anti-vaccine lobbies, but we have to take a rational call, evidence-based call. Look at the history and look at the recommendations from peak professional bodies. And for an individual's health, for the health of the family, you have to take the call. Some of the vaccines are little expensive, but it is all worth spending that amount, because a pound, like a little investment this at this point in time will help preventing bigger diseases in the children. So this is all what I have to say, that as per the recommendations from WHO or Indian Academy of Pediatrics, whatever vaccinations are recommended in your geographic locations, please take them, because that will help not only protect yourself but your family also. Wish you all the good health. I think, I hope this was the third wave of COVID was the last wave, and we are not going to see any more COVID. Currently, fortunately, by God's grace, the numbers have come down, and I hope that it remains so, and we are able to get rid of this COVID and get back to normalcy. I wish you all same. Yeah.
Thank you so much, Dr. Tushar. So, to all our users, Dr. Tushar is available for video consultation. उनका link दिया है post में. You can book a video consultation अगर कुछ doubts है, कुछ suggestions, treatment. He is always there. Additionally, अगर कोई suggestion and doubt, कोई normal queries है, so I'm also available on Baby Chakra as an health and wellness author. So we can connect you to the appropriate doctor so that you can take care of your doubts. Thank you so much, and thank you, Dr. Tushar. We had a lovely session with you.
Thank you, Seema ji. Thank
Thank
you,
you.
all the viewers.